Alright, good morning. I'm going to do a nasotracheal suctioning. So the first thing I'm going to do is check the patient's chart, check if there's any medical history that I need to know about before I do any suctioning. And then once I'm ready, then I'll enter the room, knock on the door, introduce myself, and then I also check the patient's ID band, and then I'm going to wash my hands, dry them, and then I'm going to always get their vital signs before I do any suctioning. And I'm going to apply any appropriate PPE. And so with that, with the nasotracheal suctioning, you can have a gown on, face shield, anything, protect your hair, just in case if something splashes out when we are doing the suctioning. So when we are ready, I'll get everything ready. So before you do a nasotracheal suctioning, you always need to hyperoxygenate the patient. And I'll get this connected up and ready to go. And then ready to go. And I'm gonna size the nasal trumpet, okay? So you take the and go from the ear lobe to the nose there. And you can also look at the end of the bevel and see if the opening is too big or too small for their nose. And always check the patient's nose to make sure there's no deviated septum or anything like that, nothing that can cause injury to them or cause any bleeding. So I'm ready. I can lubricate the end of this and then place it into the nose, and always put the bevel towards the middle of the nose and the septum there. And once we are ready, got it in there, then we'll turn on their oxygen mask here. And once the bag is inflated, we can place it onto the patient. And then I will get my suctioning machine ready. I hook the longest tube on the patient's where it says patient, and then the vacuum tube, and then I'm going to turn on to regulate. And then it needs to be from -120 to 150. And so I can always check and occlude the opening and see where it lands. And if it's too high, we can turn it down. So I always gonna make sure this isn't kinked, no kinks in there. That way it can suction up everything and it won't get stuck in the tubing and cause any obstruction in the tubing. Okay, and then when I'm ready, also I always can get this ready beforehand too, and get the sterile gloves out like this. We have some lubricating jelly. You can place it on the lid of the basin, or you can put it on some clean gauze. And then we have some sterile water. So we would pour sterile water in with a catheter. That way it will sterilize the catheter more. And then we can place these over, and if your hands are too small or too big, then you can remove these, place them in the appropriate area, disposal, and then you can place these on if you have troubles getting it over your gloves. So you can place these on. Try not to touch the outside of them, and only touching the insides. Once we are ready, we can get our catheter. And so you're always going to have one hand be your sterile hand and the other hand to handle anything else that you may need. So I'm going to use my right hand, my dominant hand, as the sterile hand. So I'm going to grab my suctioning tubing here, and I'm going to grab my catheter with my sterile hand, and I'm going to connect it to the end piece here. And once we know it's connected properly, it's going to hear a hissing sound. And when we're ready, we'll take the end of the suctioning catheter and we'll put it in the sterile water and suction up some sterile water just to make sure everything is clean and nice and sterile. And then we're going to put some lubrication on the end of it, just so that way it goes in easy for the patient. And when we are ready, we will remove the oxygen mask from the patient, set it to the appropriate side, and then you are going to slowly go into the patient's nose once we get down there, if we feel resistance, you can back out slowly. And then once we are ready, don't want to do it more than 15 seconds in the patient's nose. Then you would slowly creep your fingers up like this, just in case if you have something at the end of the catheter and you don't want to splash it. And if the doctor needs a sample, there's a little other connection that can connect to this to get your sample that you need for the doctor to see what's in there in the sample. So every time you get done with a nasotracheal suctioning, you always need to oxygenate them again. So you'd place the oxygen mask on them again. And then you can do this up to 3 times. I wouldn't do any more than that just because it can be hard on the lungs when you do that and it can cause complications. And when you're finished with this, you can wrap it around your glove like this. Remove it carefully, not to touch anything else with it or get anything anywhere. And then you can set this over here. And you can remove the catheter with your gloving, like that, and dispose in the appropriate area. And then I would wash my hands, dry my hands again. Then I place the appropriate gloving on again, just that way it protects me too. And then I would get the patient and check their patient's vital signs, make sure they're doing okay, their O2 levels aren't off or anything like that. So when they're okay and everything's done, I always shut off this machine, make sure that's okay. And then I would remove this from here when the patient is all right. And then I can set this off to the side because they may need to be suctioned again, so we can save it for the patient. And then I would dispose of anything that I may use, like I'm gonna dispose of the catheter basin, get rid of that, and any PPE that I have worn. And then I would go chart on the patient's charts, and if I had a sputum sample, I need to make sure that gets to the lab with the appropriate label on that. And then, yeah, just check the patient's chart and let them know, the doctor and the nurses know that you did a nasotracheal suctioning.